Hyperbaric oxygen therapy is literally oxygen under pressure, and it was typically traditionally used for divers with the bends, or people with smoke inhalations, or people who have difficulty in healing certain types of wounds. We're using hyperbaric oxygen for neurological wounds or neurological conditions. So we're getting oxygen into the brain and the cerebrospinal fluid, and the whole entire body is getting bathed in this super rich oxygen environment that promotes it to heal. When we're using hyperbaric oxygen in our clinic, we're focusing on the neurological conditions. So some of these could be things such as autism, strokes, traumatic brain injuries, mitochondrial disorders, Lyme disease. There could be a lot of uses for hyperbaric, and that's just a few of them. If you think about a brain injury, you have to think of it like almost as if a bomb went off in an area. Okay, if you had a stroke and that area is damaged, again, you have like a ground zero, and then you have a fallout zone called the penumbra. And that's the area of the brain that we call the recoverable brain. Those are the areas that are in idling, sort of a shock state that we need to wake up. And when you go in a hyperbaric oxygen chamber, you are increasing the pressure with the oxygen now being able to dissolve in all of the body's fluids, and especially the cerebrospinal fluid. So you're raising the oxygen levels hundreds of times. So now those cells in the brain that have been hurt or damaged, that are in a shock state, are now able to breathe again, and they're able to heal and regenerate. And now we also know that hyperbaric oxygen increases stem cell circulation and production, so that actually you're getting new brain cells growing. Hyperbaric oxygen doesn't increase the oxygen just in one part of the body, but in the entire body. So all your cells are now able to work more efficiently with greater energy, and so your body can now heal overall at a much faster rate, and you can even detoxify better. Also, oxygen, for certain organisms, they don't like it, so they'll either die or be put in a stasis state. So, for instance, the spirochete that causes Lyme disease does not like high oxygen concentrations, and hyperbaric oxygen can be used to help Lyme patients for that reason.